So what is fibromyalgia? Well, we describe it as Fibromyalgia Syndrome now, or FMS. In the old days, fibromyalgia was a bit of a poor diagnosis. It was a poorly understood condition, and it was really patients that would turn up at the clinic, GP clinic, at the physician's clinic, be complaining of all over body pain, would be very distressed, very unhappy, and there was very little that doctors had to offer them, maybe some antidepressants, maybe some counselling. Fast forward to today, and we know an awful lot more about fibromyalgia syndrome. For example, now fibromyalgia syndrome is in fact classified as a type of nerve pain or neuropathic pain. And because of that, we now know an awful lot about the underlying features of fibromyalgia syndrome. So for example, we know that as a type of nerve pain, there is hypersensitivity of the nervous system in patients who have fibromyalgia syndrome, and as a result of that, patients have a constellation of symptoms. One of the main symptoms that patients with fibromyalgia syndrome complain of is pain, and the pain is very different to other conditions in that they describe pain which is pretty much all over body pain. Problems with the muscles, pain in the muscles, in the joints, all over from top to toe. In addition to the pain, patients with fibromyalgia syndrome often have a lot of fatigue, so they have a lot of tiredness. They also have very marked sleep disturbance, and they can also get cognitive disturbance, and that is manifest as short-term memory problems, and one problem which is often described is so-called brain fog. So you have a patient who has this constellation of pain, widespread pain, fatigue, tiredness, poor sleep, and cognitive and memory disturbance. Fibromyalgia syndrome can be a very debilitating condition, and now that we classify it as a type of nerve pain or neuropathic pain, this gives us a basis to treat it.